Good evening. Welcome to another edition of Medicine in the News. I'm your host, Dr. Lee Radosh. On this show, we've often talked about some of the latest technologies, some amazing things that can save lives, and sometimes it can cost a lot of money. What if there was something we can do that saved a lot of lives, prevented a lot of diseases and problems, and was free? Well, tonight we're going to talk about breastfeeding, which is one of the best studied things that we have in healthcare. And unfortunately, it's not as prevalent as we'd like, but thankfully there's a lot of people nationally and in our community who really promote breastfeeding and are really experts regarding breastfeeding. And I really thank some of them to be here tonight on a rainy night, but at least it's not snowing. And I want to introduce my guest tonight as we talk about breastfeeding. To my left is Miri Levi, who's a midwife with Reading Birth and Women's Center. So thanks, Miri. And then Janine Dorman, who's a lactation consultant at Reading Hospital, and Cynthia Griffiths, who's a lactation consultant at St. Joseph's Hospital. So thanks for being here. And as always, we'll take your calls if you have any questions regarding breastfeeding, either technically about breastfeeding, advocacy for breastfeeding, education. We'll take your call at 610-378-0426, and that number's on your screen. So thanks again for being here. And sometimes people may not have heard of a lactation consultant. And those of us in hospitals are very familiar. But, you know, Janine, what do you describe your job when people find out you're a lactation consultant? What does that mean?
Okay, thanks again for inviting us. And basically, a lactation consultant is a professional who helps mothers with breastfeeding, whether it's one-on-one consultations, like at the bedside, helping with positioning, with latching. We do classes for our parents. We also do telephone consults. You know, if a mother calls in and she has questions, whether she's before she delivered or after she delivered. We also do a lot of teaching with the staff so that the staff understand the basics, how to help a mother when she's in the hospital. And we also work with other professionals. We work with physicians, residents, you name it. One of the things we know is that as an RN, we can work in a hospital, but lactation consultants can also be out assisting mothers in the community. So they don't have to be a registered nurse, but I myself am board certified internationally. So I can basically help any mom anywhere, and that's kind of what we do. We're a resource person who does a lot of whatever that mother needs to make her successful at breastfeeding.
So it sounds like really an educator in all sense, to patients, to providers, to staffs. Mm-hmm. And Cynthia, do you find, what are some of the biggest challenges you have as a lactation consultant? What are some of the, if you had a magic wand and can make things a little easier?
I'd like to be in several places at one time.
Okay. Well, along those, do you find that there's not enough lactation consultants or support for that?
Definitely. Reading Hospital has 2 on staff as far as designated specifically to their duties as a lactation consultant, and then there's others in the NICU. St. Joe's Medical Center has 1. And I think sometimes I wish there were others in the community. Mary is at Reading Birth and Women's, and there are 2 in private practice that I know of in Berks County. We certainly don't work alone. We work in collaboration with the La Leche League and other professionals. However, we have quite a lot of training and an international exam to be the gold standard of lactation support.
I see. So there's a lot of people in the community who maybe can help, but in terms of a true lactation consultant who really has, really knows everything about it and keeps up, unfortunately not as much as ideal. You know, one thing we were talking before, and something, something I don't think about and most of us don't, hospitals often will have lactation consultants as part of the newborn nursery experience and sort of provide that as part of the care, but are lactation consultants covered by insurance currently? And you're saying now that there may be some challenges, that that's not as much as we'd like so far.
Well, there's legislation pending in several states, and Pennsylvania is working on it with the legislature in getting us licensed. I, like Janine, am a registered nurse, so I'm licensed in that profession. I'm an international board certified lactation consultant, so I can stand alone in that practice. unfortunately, there's no reimbursement. You have to be
goodness.
licensed to be reimbursed by the insurance companies. So that's an uphill battle. We have to change minds to understand that we offer extra special services.
Right.
And of course, with given all the benefits about breastfeeding and in the long term, all the cost savings, you know, it's a no-brainer. And Miri, in addition to being a lactation consultant, you're a midwife. How do you incorporate that in your practice? Do you find it's helpful to talk to women early in the pregnancy about breastfeeding to answer questions and help promote that?
Absolutely. We do a ton of breastfeeding education at the birth center and at our Exeter office. We talk to women about breastfeeding several times throughout the pregnancy, and we also do a lot of prenatal assessment to see if there's any sort of risk factors for problems with breastfeeding later. So we have a look at women's nipples during their first visit and make sure that they don't have retracting nipples or inverted nipples or flat nipples, because there's things that we can do for that ahead of time before you have the baby. And then we always ask, you know, did your breast grow during the pregnancy, and are you able to hand express any milk ahead of time? And those are good signs that you're going to have a lot of milk supply. Otherwise, you know, maybe you are going to have some trouble, and we can get on top of that right away.
Okay, so it is. And do you find that part of your roles is, as you said, going to providers to get all of us early on to be, you know, get the wheels churning? Is that something?
Yeah, that's definitely something we want to work on, is getting the word out there that everybody should be doing these kind of assessments on women and helping them ahead of time to be as prepared for breastfeeding as they can be.
Correct.
And I think most people are aware that breastfeeding is very beneficial, although there are many barriers to breastfeeding that we can talk about. What do you find in terms of the balance of coaching women, educating, promoting breastfeeding, while still not alienating those who choose bottle feeding, not making moms feel guilty, things like that? I mean, that's got to be a tightrope that you guys walk.
Right. What I find is I like to ask a mom, you know, they know that I'm the lactation consultant, they know my job is breastfeeding, and so that can put them on edge, like I just want to try breastfeeding. But I tell moms, you know, my goal is to help you, so you tell me what your goal is. As a mom, you know, I'm invested in this relationship, but I need to know what your goal is. And then my job is to help you accomplish that. So if your goal is just to breastfeed to get that colostrum into the baby, just to breastfeed till I have to go back to work, or maybe mom's a little like, well, I don't know if I want to breastfeed, but I definitely want to pump and give the baby breast milk. You tell me what you need me to do, and then we'll do that. I'll help you be successful. So my job is to get her started, give her the right information, then she can make that choice and decide, oh yeah, this isn't so bad. Because even the moms that say they want to try, somewhere along the line they know the right thing, they know the right information, but they're just not sure, can I do it? Do I have the support I need? All of that. So part of it is like, okay, you know, even if you don't want to, that's okay. You know, it's not my decision, it's a personal decision. You need to make up your mind.
Okay, so you don't frame it as this is good, that is bad, or anything. It's more of, here's some options. What can we do to help you with those decisions and provide the information?
Right, you're always promoting breastfeeding as the gold standard, but I also want mom to welcome me in, like invite me in, tell me what I can do, tell me what you need me to do.
How about, Miri, do you find challenges with that, balancing, promoting breastfeeding, yet maybe women have a preconceived notion that they can't or won't, or you know, they want to, but they know their work may not be the optimal place to allow breastfeeding?
I find the majority of women want to breastfeed. Sure, there are some people who are like, that's really not for me, I'm not interested, you know, I don't want to talk about it. But the majority of women really want to breastfeed, and often they have problems postpartum and they don't have the support that they need to get through some of those issues that often are small problems that they just need a little tweak here, a little tweak there. But overall, I think most people want to breastfeed. And we start, in terms of our breastfeeding education, with here are the medical benefits of breastfeeding. It's really great for you. It's really great for the baby. All right, if you're interested in that, let's talk more about how we can help you breastfeed.
Okay, so again, listening to their needs and meeting them on their level.
I think our job as healthcare providers, breastfeeding is a public health issue. It's not simply a choice, and I think there's so many misconceptions out there that have changed. My mother nursed all 9 of us, and every time I talk to my mom, it's, oh, Mom, there's a new study, you know? And it's pretty funny to hear her perspective on things. But these moms come in with so many questions, and to ask them, how can I help you? What questions can I answer so that they get the knowledge they need to make an informed decision?
You know, along those lines, what do you find as the most common barriers? You know, because there's some obvious ones if a woman just comes in and definitely doesn't want to, but what are some of the other barriers that you find that limit breastfeeding as much as it could be?
Pain.
Pain.
We run what's called centering pregnancy groups. They're awesome, and it's prenatal care in a group. And so when I go, I don't give a breastfeeding class. I say, what do you think of breastfeeding? What's your one word? And half the group will say, pain. So let's talk about that. Nursing in public. You know, I don't want to pull it out in public. I didn't either. You know, let's talk about that. So those are the kinds of things I think I hear most.
I think we live in a society where people are just not that connected with other people anymore. People live sometimes far from their family. People in their family didn't necessarily breastfeed, so there just aren't a lot of people around to support them and help them through that initial process of saying, like, this is normal, or if you just do this, it'll be a bit better. So, you know, lactation consultants and the support in the community is really important, especially in the first couple weeks, to try and help women through some of those early times.
Right. And there's a lot of misconceptions. There's still a lot of myths out there. There's still a lot of people out there who are talking not only just about pain, but, you know, maybe you won't make enough milk, you know, and how do you know the baby's getting enough milk? And then dad says, well, but I want to help too, you know, or grandmom, you know. So there's still a lot of misinformation, and the standard isn't always breastfeeding. The standard is, this is a bottle, this is how you feed your baby, you have to go back to work, you have to do this and that. So mom has so many different things, and then I'm tired, and, you know, like the misconceptions, you know, that's a big barrier, you know, and sometimes they don't know what they're supposed to know, so they don't even know the right questions, and so that's where that, I want to try, but it's not a real vested interest. Like if it doesn't work right away in the hospital, that's it. We have the bottle to fall back on.
Right, and again, that's your role as an educator, I suppose. Well, we're going to take a quick break and be back in a minute with Medicine in the News.
You're watching Medicine in the News on bctv.org. Be informed, be involved, be a member. For membership information, go to www.bctv.org/support/membership. For more information about your community and other health-related stories, go to bctv.org. Medicine in the News on bctv.org is underwritten by the Reading Hospital and Medical Center. For more information on how you and your business can become a program underwriter, go to bctv.org.
Welcome back to Medicine in the News. I'm your host, Dr. Lee Radosh. Tonight we're talking about breastfeeding, particularly about the barriers to breastfeeding and some of the local resources we have to promote breastfeeding and educate. As always, please call with any questions or comments on the topic, 610-378-0426, and the number's on your screen. I'd like to reintroduce our guests this evening, and again, I thank them for coming in. We have Miri Levi, who is a midwife with Reading Birth and Women's Center, also a certified lactation consultant. Janine Dorman, who's a lactation consultant at Reading Hospital, and Cynthia Griffiths, who's a lactation consultant at St. Joe's. Before the break, we were talking about some of the barriers to breastfeeding and issues that may arise, and one of the biggest things that a theme that came up is resources and support. And there are a lot of local resources and support, and one thing I've been learning about this evening is that a lot of these resources have come together and are creating a new coalition, the Berks County Breastfeeding Coalition. And I guess, Janine, can you talk a little bit about what that is and who's involved?
Okay, good. This is something that came about from all of us coming together at different times saying, you know, there is a need in the community. So we came with the conclusion that if we started a coalition to look at the resources out there and then to implement some sort of, you know, helping these moms. So the Breastfeeding Coalition came about and it's dedicated to the community in terms of our mothers, giving them the resources to protect, promote, and support breastfeeding, and ensuring that their goals, their personal goals, are met. And it's also working in collaboration with the community. So we have at least 15, maybe more different community-based groups, the La Leche League, the Women's Birth and Women's Center. We also have Nurse Family Partnership. We have WIC counselors. We have a lot of different communities, and part of what we would like to do is assess that community support out there. What are the resources? Where are the barriers? Where are the needs? And then work on that, so that part of our mission is to then implement programs to give those mothers more support, more information, more of what they really need to make breastfeeding successful.
Do you see part of the coalition's role as exchanging ideas, resources from one organization to another? So, for example, if in the Reading Birth and Women's Center, if you found that there was a woman who needed something from one of the hospitals or WIC or something, that you would facilitate that?
Sure, absolutely. And also sharing like what's working for one organization and what's potentially not working for another organization. You know, at our practice, our nurses call our patients every day for the first week. We see them at a week postpartum to really assess breastfeeding and make sure that it's working. Not all the practices are able to do that or know that that might be helpful and aren't sure how they could incorporate that. Our job is, for the coalition, is to help those organizations incorporate things like this that could really help with breastfeeding.
Right.
How about, and Cynthia, what's your perspective on how a coalition like this could benefit the community?
Bringing these groups together, because our clients overlap, our moms overlap. One of our goals was to do a survey. Miri had done this wonderful survey where we could go put in what's working, what's not working, and then what are some of our goals. And one of the goals is to have this support group at WIC for WIC clientele that they can just drop in the waiting room, and it would be run by us at different times. From 10:30 in the morning until noon, we would provide simple snacks, healthy snacks, and model behavior. It doesn't take the place of a client consult, but it does
It's a great
help
education.
with what are your questions today. So that's one of the things that we hope to put in place by the end of summer.
Okay, so there's a lot ongoing.
Right. And we also are incorporating all the resources out there and bringing it all together. So as a coalition, we are compiling all this information, and so that's the other thing. We want help from all the different organizations, you know, from the public, you know, like how can we help you, you know, show us those needs, and then what we're going to do with that is then make that available to everyone, not only in the coalition, but put that out. And so Miri's been very good at working through like a web page and a Facebook, and you know, so it's communicating with different social media that our clients are looking at. You know, they're looking at Facebook, they're looking at all these things, and so we're going to bring that right up in the forefront so it's more accessible to our patients.
Actually, if we could bring up the a graphic from the computer. So this is the web page that you guys have started, and again, Berks County Breastfeeding Coalition. We'll put the address up at the end of the program, but it's berksbreastfeeding.com, pretty easy to remember. So is the goal that this website would be a sort of a one-stop shopping for moms, for others to find out about breastfeeding tips and or local resources? Is that the goal?
Yeah, absolutely. There's going to be a resource list on there of all the lactation consultants in the area, all the places that have breastfeeding classes, all those kinds of resources for the community, support groups and those kind of things. And then our Facebook page will also be a place for people to come together a little bit and talk to other people in the area, ask questions, you know, look for resources that way.
Share stories, maybe talk about employers that aren't as helpful, hopefully not doing things like that. So it sounds like there's a lot of obviously great potential for that. Do you find that along those lines patients are using multimedia more and more, or going to YouTube to learn how to breastfeed, and is there good and bad points about that? Or
I think all three of our facilities do put decent websites out there, bestforbabes.org, Little HA League, things like that, that you want them to go to for information. We don't want them to go to, well, my mother used this, my sister used that. We would prefer evidence-based information.
So more vetted
And that's going
websites.
to be on. But mothers do use Facebook. It's amazing how they call in and they'll email me and say, well, I sent a picture. What do you want to do about this? And I'm kind of interested in how media is going to change our consults.
Well, you know, along those lines, you know, we were talking about some of the societal obstacles. Do you see things in the past 3, 5, even 10 years shifting, that the public is more supportive of breastfeeding, or employers? How do you feel things are heading with regard to that?
I think breastfeeding is definitely more in the media. More people know about it. You know, movie stars are breastfeeding, and that's always great because it's just more people promoting breastfeeding. And I think it's kind of getting out there. A lot of the new laws in Obamacare, although they're not fully implemented yet, do support breastfeeding and support lactation consultants. And I think everybody's sort of working on trying to get those really well implemented to support people. You know, health insurance is supposed to cover a pump for women who are breastfeeding, and there are laws that require large companies to help women when they go back to work to pump at work.
And what kinds of things, I think we were talking a little before the program, what types of things do large employers, do they need to offer in Pennsylvania, at least according to the law?
Right, so any company that has more than 50 employees has to allow their employee to take unpaid nursing breaks, about 15-minute nursing breaks, and they have to provide a room to pump in that's not a bathroom.
Okay, so they do need a private space. So women need to know that the law is on their side. If they're at a big local corporation with a lot of employees, they should feel comfortable going to their supervisor and saying, listen, I want to come back to work, but you're going to need to give me time to pump in a private area periodically.
Absolutely. And the federal government has a lot of information on their webpage about what businesses need to do and how they can make that happen, and you can take that to your employer and say, like, this is what the federal government is suggesting that you do to help me continue to breastfeed my baby when I come back to work.
Okay. It's also nice to know, like when we teach moms who are coming in to do our working and breastfeeding class, it's also teaching them how to talk to their employers, getting the employers and those that are working with them to understand that this is a benefit for them too. You know, moms that breastfeed, they have less ill visits with their children. So, you know, they're missing less time at work, they may be more productive, all of those kind of things. So it is helpful. But in terms of a society obstacle, we still look at those women issues. And so it would be nice too that if other women would then help those moms. So I tell moms, you know, go out, find out who is where you work, you know, what they've done, what barriers they found, you know, come prepared to talk to your supervisor, you know, how can you make it easy for them to help you? So we still need to help everyone as women in a society where, you know, this is a reason why we're doing this. It's very beneficial. It's a public health issue.
Right, it's a win-win for everyone, but it's a lot of times employers, people in general, we're ignorant in the literal sense of the word, just don't know. And I know that there's an upcoming support group with and through the Breastfeeding Coalition. It sounds like these types of issues could be discussed. What types of things do you talk about in support groups?
Well, basically, it's what do you want to talk about today? So you ask the mother. Perhaps it's a low milk supply. You know, how do we tell the baby's getting enough? That's a huge barrier to women. Perhaps it's diet and breastfeeding. You know, I'm told I can't have rice and beans, I can't have spices, you know, things like that. If I drink more water, I'm going to make more milk. Not necessarily. You know, things like that. So you could get a variety of questions. I got a cold. So should I wean? No. You should continue to breastfeed, things like that. So you have to be kind of on your toes. Those are the best support groups where you're open to whatever those families want to talk about then, you know.
Well, it sounds like some of those things which, like you said earlier, some of the things that you offer are very simple things to fix. It's just that women need to feel comfortable asking, and sometimes they don't know to ask, and that's where those myths outcome that you were talking about. I always find when I'm educating patients, sometimes you talked about movie stars and things, and it's good, but sometimes there's this notion that breastfeeding is so easy and it should just happen naturally, and if it doesn't happen within the first attempt, within 10 seconds, they stop, and it's no, it's a lot of work and learning each other. And
that's one of the biggest misconceptions. Is that everybody should just be able to breastfeed without a problem. It's a learning process for everyone, for a new baby who's never breastfed before, and for a mom, even if she has breastfed, for other children. Each new baby, it's a new process, and you have to learn how to do it.
And it's this analogy that, you know, like it's like riding a bicycle. For some of us, it's very easy to do. Those of us that are adopic, we skin our knees a couple of times, we get back up, and we
but eventually you get
finally figure it out.
How to do.
So every one of us is different, but...
Well, we are unfortunately just about out of time, and there's so many other things I wanted to ask, but I most importantly want to thank our guests, Miri Levi, again, a midwife with Reading Birth and Women's Center, Janine Dorman, a lactation consultant at Reading Hospital, and Cynthia Griffiths, a lactation consultant at St. Joseph's Hospital. So I think the big message for tonight is think about this Berks County Breastfeeding Coalition. Again, the berksbreastfeeding.com, and please just ask questions and promote, and we have a lot of great resources. So have a good evening, and thanks again.
Thank you so much.
Thank you.